case of posterior wall MI, so first we had to place the leads V7, V8, V9 in the same fifth intercostal space, but behind and under the scapula. So on doing so, you can see clearly that we have V5, V6 which is lateral, and then going back you have the posterior wall leads. You can see this ECG in which you have a posterior lead that is V7, V7, V8, V9 has a proper ST segment elevation, and anterior leads have a ST segment depression. So that is clearly suggesting that this is a case of posterior wall MI. I'd like to tell you about inferior wall MI as well. So in case of inferior wall MI, you can see that the ST segment is elevated in 2, 3 AVF. So that is why quite clear. But which are the reciprocal leads? One and AVL, which is high lateral. It's like high lateral, so higher side. So that is what is opposite to inferior, and that will show you some amount of ST segment depression. Case where 1 and AVL is showing ST segment elevation, along with ST segment elevation V2, V3, V4, V5, V6, which is suggesting a simple thing, that is anterolateral wall MI, and reciprocal changes are present in the inferior leads. So this is the other lead where you can see ST segment depression. So whenever you have some amount of elevation, check the other leads, you will find for depression. To put it in summation, if the inferior leads are going to be showing you ST segment elevation, look for the compensatory leads, that is high lateral leads. If you're seeing ST segment elevation in anterior leads, you can see for some amount of depression in the inferior leads. Posterior leads are not generally placed, so you cannot see that. If you place posterior leads and appreciate the kind of ST segment elevation in it, so look for depression in the anterior leads V2 to V6, specifically V2 to V4.